Good afternoon. I'm Jeff Birdwell, Director of the Huntsville-Madison County Emergency Management Agency. It is Wednesday, September 7th. On behalf of Mayor Tommy Battle, Mayor Paul Finley, Commission Chairman Dale Strong, Huntsville area government, healthcare, and our emergency response agencies, we bring you this briefing on our community's response to COVID-19. Our speakers today will be Mr. Tracy Doty, President and Chief Operating Officer, Huntsville Hospital; Dr. Robert Chappell, System Chief Medical Officer, Huntsville Hospital; and Dr. Wes Stubblefield, District Medical Officer, ADPH Northern and Northwestern Public Health Districts, Alabama Department of Public Health. Before we go to our first speaker, I'd also like to recognize that Mayor Battle is in the audience as well. I'll give the current numbers. As of last Thursday, the last update by ADPH, there are 1,494,300 confirmed cases in the state of Alabama. In Madison County, there are 105,215 confirmed cases, having resulted in 997 deaths. Positivity rate is 21%, and again, as of last Thursday, the 7-day average of daily increases in Madison County is 128.29. At this point, we'll go to our first speaker, Mr. Tracy Doty, Huntsville Hospital.
Thank you, Mr. Birdwell, and I want to thank our city officials for putting this on again so we can educate the public on what's going on in the community, and also start out by thanking our healthcare workers and frontline staff for all the hard work they're doing. Currently in Madison County now we have 70 COVID positive inpatients, 70 patients in the hospital that need to be taken care of in Madison County, and they are as follows. We have 65 of those at Huntsville Hospital, 59 downtown at Huntsville Hospital, Maine, 5 in Madison Hospital, 1 in Women's and Children's, and we have another 5 at Crestwood. Of those patients, we have 8 of those patients are in the ICU total. So doing much better from an ICU perspective, percentage-wise, than we did early on in the process. As Mr. Birdwell said, the positivity rate in the state is about 19%, and our ERs, both at Crestwood and Huntsville Hospital, are about the same, a little bit higher, about 21% at both locations. So we're continuing to monitor that. Everybody's doing well. Staff's working hard, and we appreciate the support we're getting from the community. I will remind everybody that COVID's still around, so do all those things that you've learned over the last year and a half, 2 years, that protect yourself. Masking and staying away from people that are sick. Stay away from people. If you're sick, don't go to work, and make sure you get a test. As I conclude, again, thank you to our healthcare workers and frontline workers, and I'll turn it back to Dr. Chappell, Mr. Birdwell.
Yeah, thank you, Tracy. Now we'll go to Dr. Robert Chappell, Huntsville Hospital System.
Thank you, Mr. Birdwell. Thank you, Tracy. And thank you, Mayor, for having us today. The medical community is pretty excited that we've got a couple of new vaccines for our community, one being the booster by Pfizer and Moderna. For the first time, we've actually got a vaccine that matches the circulating virus. The virus has been mutating so rapidly that it was difficult to catch up. So we're excited that this vaccine is actually matched up with the the Omicron subvariant BA4 and BA5. So that's exciting. And Dr. Stubblefield is going to give you more details on that rollout. The other vaccine that's out there is Novavax. You may have heard. Now, we still have a number of community members and Americans that have not received their primary vaccination. And Novavax is not a booster, but it is for primary vaccination, and this vaccine has been in 40 countries and been used for a while, but it's what I call an old school vaccine. It's not the mRNA technology that the Pfizer and Moderna. So for those that want primary vaccination, that's another alternative. I do say that it's important that we have these coming along when we do. We're heading into the winter months. Things have gotten a little more relaxed, which is good, but back to normal. We're going to football games. But I think we got to remember that COVID is still a significant health event. We still have in America, we still have 500 people die per day each week. Tracy and I will listen to our calls daily, and it's not unusual to hear about somebody that's passed away from with COVID. So that's important. The other thing that's I think I would want to emphasize to community is not to forget about the flu. Influenza. We watch the southern hemisphere, like Australia, and they're having a very bad influenza outbreak. And I think we did well last year because so many people were masking. That has been relaxed. So we got to, you will be able to take the influenza vaccine along with the COVID booster, which is, I think, a great thing. People can get both vaccinations at the same time. So again, thank you for allowing us to be here, and I'll turn it over to Dr. Stubblefield.
Thank you, Dr. Chappell. Now we'll go to Dr. Wes Stubblefield, Alabama Department of Public Health.
And again, thank you to everyone for allowing us to be here. And to build on what we've already talked about, COVID is not gone. We continue to have upwards of close to 600 people hospitalized in this state on a daily basis. We continue to have almost daily reports of deaths across our state. COVID-19 can be and still is a serious illness for certain people, and it can be for anyone. The exciting news, as it's already been mentioned, is that we have new options for vaccination. This new vaccine, this bivalent or two-sided vaccine, is available to anyone, any person that is 12 years of age or older who has received, who can receive the Pfizer vaccine, or anyone 18 years of age and older who can receive the Moderna vaccine. This vaccine simply replaces the booster that you would have gotten anyway. So it really is just taking that other booster away and giving you this one. Now, all recommendations that were in place are still in place for individuals for their vaccination series. So really, you should go to the CDC website to know whether or not you have been fully immunized against COVID-19 and are up to date on your vaccine. Those 50 and older are eligible for that second booster, and that would be the bivalent booster from this point on. So we would highly encourage that those 50 and older consider this, especially those at high risk. Younger children under the age of 12 can still receive a booster down to age 5. However, that booster will continue to be the monovalent or the single unit vaccine for this from right now. We anticipate that those ages will decrease over time, although we do not have a timeline on that. Again, for more information, I would visit the CDC's website, where they have very nice infographics about what vaccine you are available and eligible for, and how many doses that would be for your individual situation. The second part is about the vaccine rollout. As the CDC only signed off on this recommendation late last week, there was the ability, in anticipation of CDC's ruling or their authorization, that you could pre-order the vaccine. So many of our retail pharmacy partners, hospital systems, county health departments were able to place pre-orders, and those are starting to come in after the holiday weekend. Now, this is going to be a incremental rollout. We at the Public Health Department are not fully ready to start administering vaccines, although we will advertise when that is ready. But many other places may be able to. So be watching for the ability for you to receive a vaccine if you're interested, especially if you're interested in receiving and are eligible for the new bivalent vaccine. These vaccine supplies should ramp up very quickly, although in the beginning there will be a limited supply. So remember, we encourage, as it's been said before, get your primary series, stay up to date with your boosters, get your flu vaccine for this upcoming winter season. The last 2 years, we've seen spikes in the winter. So let's prepare ourselves in our communities and our hospitals for what might be coming in the next couple of months. Thank you.
Thank you, Dr. Stubblefield, and thank you for watching today. At this point, we do not have another scheduled briefing, but for any COVID-19 information, you can go to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. So with that being said, we will go to questions. We do ask that as you come to the mic, you identify yourself and who you are affiliated with.
Matt Kroschel, I'm with WAAY TV. The psychology of a pandemic, now that we're moving into another phase of more boosters, and it's kind of confusing for folks to know do they even remember where they're at? How do you keep people interested in knowing this information and actually getting out the door, at the same time trying to tell folks, well, we might have the supply this week, but we might not, we're still ordering? What is the messaging moving forward going to look like to keep this front of mind for folks that maybe are not experiencing a pandemic like we were a year or two ago?
I think the most important thing for the public to remember is that we're not out of the woods yet. Now, there's always the possibility that this virus may mutate in a way that we've not seen, although it's also possible that it may stay in sort of this, we talk about the Omicron, that family that it's in, but there may be another variant that escapes our immune system in a different way. And that's why this new vaccine is so important, because of the broad protection that we get. And I think from this point on, we need to stop thinking about this as sort of the pandemic and it being over. We really need to start thinking about this being something that we need to move forward with. And moving forward might be that we have to keep up with this virus and what it's doing in the way that it's mutating as it's been talked about over time. We don't know what that looks like yet, but for now, let's think about let's start to think about this like the flu. We need to get our flu vaccines. They are updated on a regular basis because the circulating virus changes, and so let's protect ourselves. Let's protect our immunity, our community, our economy, our hospitals, our workers, and ourselves.
Nixon Norman with Fox 54 News. This is a new vaccine. The bivalent one is different than the monovalent. But is there data that shows that it's going to work better in humans? Because I know it's not even really been rolled out yet. How do we know that it's going to be better or more improved than the monovalent, predecessor, I guess?
So this particular vaccine was authorized with clinical data based on what has happened with previous Omicron vaccines that have been given worldwide, which particularly were aimed at BA1, along with vaccine information that has been accrued over time with the ancestral or the original vaccine. So the technology is exactly the same as what was made in the mRNA vaccine. It's just a different sequence that is producing a protein that is more similar to what the body would recognize as BA4 or 5. So there is no anticipation that there will be any differences in what it would, in terms of side effects or anything like that. The way to think about this is the flu vaccine. The flu vaccine is not necessarily tested every year. It's changed every year, but it's based on the same technology and it's rolled out year over year. And so that's the way I think about it.
Sean Dowling, WAFF. My question is, to everybody watching, I think the first thought on their mind is going to be, when can I go to CVS to get this thing?
At this point, it's really hard for us at Public Health to tell when an individual doctor's office pharmacy, hospital system, when those will be available. They should be available soon because all of these shipments should be coming in as long as the pre-orders were made. They should be coming in this week. So as long as the processes are in place to get these vaccines, then they should be able to schedule appointments. It's important to remember that when these new vaccines were authorized, the previous booster doses were not authorized. So if you're getting a vaccine from this point on, you will be getting a bivalent vaccine as long as you meet the age criteria.
At this point, we'll end the press conference. Thank you for coming. Oh, I'm sorry. You got one more?
Archie, News 19. Dr. Stubblefield, folks are in conversation that this virus is over, especially how everyone is carrying on. Is this virus over? Is this booster going to make a difference?
We absolutely hope so. This virus will probably, it's hard to tell if this virus will ever be over. Right now, what we need to focus on is that it's still hurting Alabamians. It's still hurting our family members, our loved ones. We've lost so many and we've lost so much for this virus. We are in an exciting era of technology and science that allows us to fight this virus. We have treatments. We have a vaccine. We need to move forward, and this is the best way that we can do it.
I'll add that, we have to live. So the community's open. We have to go to Big Spring Park and have a good time, and out to the Trash Panda Stadium and to high school football games. All those things are there for us, and it helps our mental health to have those outlets. So we have to live with this vaccine and changing. We have to live with the disease changing. So as a part of the pandemic goes on, like Dr. Stubblefield said, we got to learn to live with it. Go out to restaurants, but protect yourself. Wash your hands. Stay away from people that are sick. If you're sick, don't go out and be around people. Get tested. You can get tested at most of the pharmacies around town. You can come to the ERs, the fever and flu clinic, other locations to get tested. But this is a disease we have to live with, and we can't run from it. We've got to enjoy ourselves and live at the same time.